Among the many complementary alternative medicine treatments that are commonly used, transcutaneous electrical nerve stimulation, or TENS, is an effective method of pain relief that involves no drug interactions, is non-addictive and non-invasive, and has no harmful side effects. How TENS therapy is applied. Pain relief occurs when electrodes are attached to specific spots on the patient's skin after a special steroidal cream has been applied. A mild electrical current is administered, targeted at the trouble area in which pain is being experienced. Some patients who have difficulty in traveling to a facility at which TENS therapy is available may be given a portable TENS stimulator unit by a doctor's prescription, enabling him or her to administer the therapy on themselves. These portable units range in size of that of a small portable radio to no bigger than a plastic ATM or credit card. Historical background. Although mankind did not learn how to harness and control electrical energy for practical applications until well into the 19th century, the use of electrical stimulation in order to control pain goes back as far into antiquity. In the year 63 AD, Scribonius Largus, court physician to the Roman Emperor Claudius, reported seeing patients in Greece standing atop electrical eels near the shore. Crude and primitive electrostatic devices were employed from the 1500s up through the Age of Enlightenment. Benjamin Franklin was among those who experimented with this method of pain relief. The electrete was a device invented around the beginning of the 20th century, and it was only one of several such devices that were claimed to provide cures for everything from headaches to cancer, but were in fact little more than torture devices which accomplished little. The first modern portable TENS unit, the Medtronic device, was patented in 1974, originally for the purpose of testing patients' tolerance to electrical stimulation prior to the implantation of electrodes. As it turned out, patients got sufficient relief simply from the electrical stimulation. The implants turned out to be unnecessary. How TENS therapy works. TENS therapy is not a cure, nor even a treatment for mesothelioma or other cancers beyond palliative effects. While it is known to result in effective pain relief, physicians and medical researchers are still not completely sure how this happens. It seems apparent that the physical warmth produced by the procedure and applied to the affected tissues work in much the same way as a heating pad. However, the most widely accepted theory is that, like massage and acupuncture, TENS is a therapy that stimulates bodily production of its own natural analgesics, special hormones that are better known as endorphins. Alternatively, some researchers believe that the electrical current may actually scramble nerve impulses that send pain signals to the brain. Who should not receive TENS therapy? Because it involves the passage of electrical current into the body, TENS is not recommended for people who have heart problems and are therefore using a pacemaker, as the current may interfere with the proper function of such a device. In addition, people who suffer from epilepsy should not use a TENS device. Those who do use a TENS generator on themselves must be cautious and use the device only as directed by their physician. Electrodes should never be placed on the following areas: eyes, mouth, temples, neck, numb or desensitized skin, open sores or wounds, and trigeminal nerve. Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.Net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net, information and help for patients and families.